So good evening, friends. So let us start the today's session. So we had finished with the most of the arthritic disorders in our previous class. Okay. In this class, we will be concerned with those arthritic disorders which are metabolic in nature. Okay. And in the next class, we'll be taking up your nutritional disorders, which includes your rickets, osteomalacia, or so while we had started with the general features of arthritis, okay, we had discussed what were the general features of your metabolic disorders. Okay. So let us again revise those important points before we proceed with the individual features of every metabolic disorder. Okay. So first of all, they are asymmetric. Okay. Inflammatory disorders are symmetric, while degenerative and metabolic disorders both are asymmetric. Okay. Inflammatory disorders are polyarticular, degenerative are mono, and metabolic can be mono, can be polyarticular. Okay. Two very important things. Alignment remains normal, bone density remains normal, and erosions are sharply defined. Okay. Differentiating features from degenerative arthritis is that the osteophytes are absent here, okay, while periostitis, which is a good feature for your inflammatory arthritis, is also absent here. And examples are your gout, CPPD disease, hydroxypeptide deposition disease, and so on. Okay. So let us start with gout, okay, one of the most important metabolic disorders. Okay. Now, gout can be primary or secondary, this we all know. Okay. So primary gout is basically because of the lack of excretion of uric acid because of an inborn enzyme error. Okay. While there can be many secondary causes of gout. Okay. But here, what we are concerned is with the radiological features of gout. Okay. Three types of presentation can be there. Okay. Depending on the duration, we can have acute gouty arthritis, which is an acute inflammatory monoarticular or an oligoarticular arthritis. The most common joint to be involved is the foot. Okay. And in foot, the great toe is the most common to be involved. Okay. So acute gouty arthritis will present as a acute inflammatory monoarticular arthritis or even sometimes oligoarticular, more than just two or three joints may be involved. Okay. In late stages, it can proceed on to involvement of multiple joints, which is your polyarticular gouty arthritis. And in late stages, we can have chronic tophaceous gout. Okay, wherein because of the tophi, there are adjacent changes in the bone. This is a list of general features of gout. Okay, you can save it when you want to revise it fast. So let us discuss each and every feature one by one. Okay. Now, very important thing is the latent period here. Okay. Now, here the radiographic findings they basically lag behind your clinical manifestations by a latent period of at least 5 to 10 years. Okay. You will be having your clinical features, but radiologically, those findings will manifest, which is just one slide is done. We had just discussed what are the general features of metabolic arthritis, and now we are studying the each and every individual metabolic arthritis one by one. We have started with gout. Okay, I'll show you. Just this table. I've already shown this table in my first class. Okay, this is just for your revision once. Okay, that general features are again very important. Okay, now we are discussing the individual radiographic features of gout. Okay, uh, radiographic findings, as I told you, they lag behind. They have a latent period of at least 5 to 10 years. But when once present, they are quite specific for the diagnosis of gout. Okay. We start with obviously the earliest changes in each and every arthritis are your soft tissue changes. And so in acute attack, first of all, there will be joint effusion. Okay. And the most important and specific finding will be your presence of tophi. Now, what are these tophi? Okay. These are localized increase in soft, how they will manifest on a radiograph. Okay. So these are localized increase in soft tissue density. Okay. They can range from 5 size to approximately even 5 centimeters in size. Okay. Very importantly, these are eccentric. Okay. They are usually, but not always periarticular. Periarticular is that is they involve the either the metaphysis or the diaphysis of the bone. Okay. They occur in predictable locations and sometimes they may have peripheral calcification as well. Okay. And these tophi, they are responsible for the classical characteristic juxtaarticular erosions which are seen in gout. Okay, I'll show you how in the coming slides. Okay, let us first identify what is tophi. Okay, so again, I told you these are nothing but soft tissue density areas, okay, or soft tissue swelling, okay, which produces basically a focal contour bulge. They may have eccentric calcifications as well. Okay, they may range from 5 mm size to even 5 centimeters in size. Okay, since these are the earliest changes, okay, so you'll have just a soft tissue changes will be seen. That is your either it could be your joint effusion, which will be manifested by replacement of the fat planes or displacement of the fat planes. And second is basically a focalized soft tissue swelling. Okay, that is your tophi. Till now, your bony changes have still not occurred. Okay, we are just seeing the soft tissue changes. Okay, so you can observe. Okay, these are eccentric soft tissue density areas producing a focal contour bulge. Very importantly, these are periarticular. Okay, periarticular, as I told you, these are seen at the level of either the metaphysis or the diaphysis. Okay, just adjacent to the joint space. And once the disease has advanced, okay, you can see the bony changes as well. Okay, they can cause erosions. Okay, they can cause the destruction of the subjacent part of the bone. Okay, like in this case, this is the advanced stage. Okay, few of these have still not caused any bone changes like this one. Okay, this has caused classical juxtaarticular erosions of the gout. Okay, and again, this is a tophi with obviously with calcifications. Now, a very important point you have to remember here is even till the late stages of the disease in gout, the joint space is preserved. Okay. Okay. Even if you'll have coexistent soft tissue changes, you have your juxtaarticular erosions. What are your soft tissue changes? Your tophi. Okay, plus your juxtaarticular erosions, even if they are present, the articular space or the joint space may still be preserved. Okay, it is preserved till the late stage of the disease, and in the late stage of disease, you will have uniform loss of joint space. Okay, because there will be complete cartilage loss, which will lead to uniform loss of joint space. Okay, but however, in comparison to your inflammatory arthritis, bony ankylosis is an infrequent sequence. You will rarely see gouty arthritis progressing onto bony ankylosis. Bony ankylosis is a classical and a most specific feature for inflammatory arthritis. Osteoarthritis will lead to your destruction of the joint. Inflammatory arthritis will most commonly lead to bony ankylosis of the joint. Gout will also lead to somewhat destruction of the joint. Okay, very rarely it will lead to bony ankylosis. Okay, so now there are two diseases which show uniform loss of joint space. Okay, one is your inflammatory arthritis, and one is your late stage of gout. Okay, so please remember it's a late stage of gout. So if somebody asks you the general features of gout, you will say that the joint space is preserved even till the late stages, or even till the soft tissue changes and bony tissues and bony changes they have appeared. Still, the joint space will be preserved. Only in the later stages of gout there will be a loss of joint space, and what kind of loss? It will be a uniform loss of joint space because of complete erosion of the cartilage. Now, the bony erosions in gout can be of all the three types. It can be marginal also, it can be periarticular also, it can be atrocious also. Okay. The classical ones which we see, which are your juxtaarticular or your periarticular erosions, okay, these are the most common. However, you can see marginal erosions also, you can see intraosseous erosions also. So let us discuss each area, each erosion one by one. Mitral erosion, as we all know, it's because it's occurs in the bare area of the wounds. Okay. The cause here is still your synovial pannus. Okay. The periarticular erosion, which is classical for the gout, okay, it occurs because of an extrinsic pressure. Okay,